Hi, today we're going to talk about diabetes type 2 and the medications one would use to control that. We're here with Dr. Keith Dawson, who is a specialist in diabetes, and I have a few questions for him. So my first question would be, if someone is following a healthy diet, healthy lifestyle in general, exercising regularly, is it necessary for that person to take medication?
Well, the reason that a lot of people, and probably most people ultimately, need to take medication is to control the blood sugar to a level that's healthy and maintains their state of health so that they don't get the complications. Usually that level, by the way, in millimoles per liter is a level less than 7 millimoles per liter before eating and a level less than 10 2 hours after eating. If you use milligrams per deciliter, those two numbers are 126 and 181. Now, there are a whole lot of medications that one can use to get that blood sugar down if lifestyle doesn't work enough. What are the medications that we use? There are a group of medications that lower the blood sugar by stimulating insulin production, which drives blood sugar into the blood cells and lowers the blood sugar in the bloodstream. There are a group of medications that make the insulin work better, because one of the hallmark features of type 2 diabetes is that the insulin doesn't work. The insulin is, you are resistant to the action of the insulin. So there are a group of medications that enhance insulin action and make it work again. And there are other medications that work in different ways as well. All of them, in effect, lower the blood sugar. Now, one of the problems is that you can take a medication that lowers it too much and causes too low a blood sugar or hypoglycemia. And those are difficult problems. So that there are medications that don't do that but lower blood sugar to a lesser degree. So let's discuss these types of medications.
So what would be a medication that you would start with?
Probably the one that's started by over 90% of people nowadays is metformin or glucophage. That's a medication that stops the liver from producing too much sugar. And it's a very effective medication for particularly lowering the fasting or first morning blood sugar level. And that medication is taken as a 500 milligram tablet once, twice, 3, or even 4 times a day, 2 in the morning, 2 at night. That medication does not cause too low a blood sugar. It reduces your blood sugar, and more importantly, it doesn't produce weight gain, which some of the other medications do.
Does it have any side effects?
Yes, unfortunately, in a small number of people, the side effects are significant. In about 5 to 7% of the population, it causes gastrointestinal upset. In other words, stomach cramps or loose bowel movements and some sense of nausea. Usually that passes if you take the medication with food or you take it at a smaller dose. But most people can take that medication without any trouble. And it's really effective for quite a long time. It works for several years in most people.